Hi, this is Dr. Vinton with the Pain Relief and Wellness Strategy Center, and today we're discussing osteoarthritis of the knee. We have other videos where we discuss cortisone, we've discussed the gel shot or the visco supplement or what they call the chicken shot. Then we move into things like an ablation, right? So an ablation is where they actually go in and they burn the nerve, right? They try to put it to sleep. It works about 40% of the time, and it can put the nerve to sleep for upwards of 10 months. But here's the challenge. It didn't fix anything. All it did was kill the nerve signal so that you can't feel the pain, which may allow you to walk and go hunting, even play tennis. The challenge is like putting tape over the oil light on your car. You didn't fix anything. So you're still driving that car with the oil, you're burning up your engine. Same thing with your knee. When that nerve wakes back up in 8 or 10 months, you now have more damage to the joint. You're gonna have more pain. So they try to burn the nerve again. Again, this is not a long-term solution. Short-term at best, still leads to a joint replacement surgery, but it is an option. It is covered by most major insurance carriers, but there are far better options as long as you can still extend or lay that knee flat on the mattress or flat on your favorite chair. You not only can you get out of pain, but it can actually help you avoid a potential future joint replacement surgery. That's a conversation that we should have. So what happens is that when you have osteoarthritis, and there are 4 stages, right? So that many doctors aren't experts in this. They're just your standard doctor, and they're just handing out cortisone like it's candy or injecting gel shots in a knee that's like a grade 3.8 out of 4. People always say that didn't work. Well, just understand it never had a chance to work because those things are appropriate for an early stage, not a middle to a late stage. What makes us at the Pain Relief and Wellness Strategy Center unique? Number 1 is the number and the type of doctors we have under one roof. So we have physicians and pain management and surgeons and chiropractors all working together. That's incredibly rare. On top of which we can do all the standard stuff, many of which you probably already had or heard of, but then we can do an additional 9 or 10, sometimes 12 additional possible treatment options that your family physician, even your surgeon, aren't familiar with, have never performed, and as a result, we're able to help people. That's why people come from all over the country to avoid having a surgery and to be able to get back to and enjoy the things that they enjoy most without having a surgery. So for us, as long as you can still lay that joint flat, even if it hurts, even if it creaks or cracks, and this is a mobility test, as long as you can still move it, we're still able to help. And because we have such an array of doctors and we have the best equipped private facility in the country with treatment options that go far beyond what your average physician or physical therapist or orthopedic surgeon or chiropractor might do, let alone do it all under one roof, we are truly experts in helping folks avoid having surgery